Hey, Airport Fire, it's Dr. Mackey. It's May 30th. I'm going to continue on with our administrative policies. This is document number 2525, pre-hospital notification. In this policy, I want you to think of three buckets. The first bucket is just a general hospital notification. It's a courtesy notification that you're on the way in with a patient. The county has recommended a specific format to that. I'll go through that in a second and give you an example. The second bucket, alerts, specific types of patients going to specific facilities for a specific diagnosis or reason. The final bucket, MCI pre-hospital report formats. Okay, so let's start with our just generalized notification. You can see it here in this box. Rather than read the box to you, let me give you an example. As if I were a paramedic coming in on Medic 30, I'd say Kaiser South, this is paramedic Mackey on Medic 30, coming into you code 2 with a ETA of about 15 minutes. We have on board today a 48-year-old male who complains of nausea and vomiting. He's had nausea and vomiting for about the last 24 hours, and he denies any blood in his vomit, no blood in his stool. He's completely awake and alert, has no abdominal pain or chest pain, and has no significant medical history. We have a set of vitals including a blood pressure 120/70, a pulse rate of 110, oxygen saturations of 96%, respiratory rate of 18, and as I mentioned, he is alert and oriented. We have started an IV. We are giving him a 500 cc bolus, and we've given him 4 milligrams of Zofran IV, which is helping him feel better. We will see you in about 10 minutes now. Do you have any questions or orders? Trauma patients going to trauma centers is going to need a trauma alert. Patients meeting STEMI criteria. So they have a 12 lead that's been done that shows STEMI. Sepsis. Patients meeting sepsis criteria for the county. That's a sepsis alert. Stroke. This one I want to spend a little bit of time with because this has caused some problems in the county. If the patient has possible stroke symptoms that are less than 24 hours old and have a positive stroke scale, then you're going to go to a stroke center and you're going to call in a stroke alert. And then finally, cardiac arrest patients, you're going to call in a cardiac arrest alert. Okay, so think of these alerts as a hospital requiring a specialized team that needs to be activated to take care of them. A trauma team, stroke team, STEMI team. Sepsis and cardiac arrest are two that require a lot of resources in the emergency department. They like those called in ahead of time. All right, finally, moving to our MCI pre-hospital format, you're just going to be very, very brief and clear. You want to make sure you talk about the incident and the type. It's usually going to be trauma. If there are triage tag numbers, you can talk about those triage tag numbers. But mostly you're just going to keep this report very, very short with a brief set of vitals. Okay, that covers this policy, pre-hospital notification. We'll see you on the next one.